Good afternoon everyone. I'm Dr. Khushi Shah and my topic for free paper is evaluation of reasons of glaucoma treatment dropouts in a tertiary healthcare center. There are no financial disclosures. Now, as we all know, glaucoma is the leading cause of irreversible visual blindness with the toll expected to reach about 111 million by 2040. As the symptoms in glaucoma are not so debilitating, patients tend to ignore the importance of follow-up, which is essential for visual preservation in these patients. Disease progression resulting from improper follow-up actually increases the cost to the society because of hours of productivity lost and need for advanced therapeutics, and hence a greater understanding of the barriers to follow-up are required for the clinician to develop targeted strategies to overcome these problems. Hence, the objective of my study is to identify various barriers to follow up in glaucoma patients. So it was a cross-sectional study amongst all the glaucoma patients presenting to our hospital between Jan 13 to 16 who were on some kind of glaucoma treatment, and we contacted them by the help of their phone number. Those who were not coming for follow-up more than a year were labeled as dropouts, and a pro forma was filled via telephonic questionnaire. Various reasons of leaving treatment were enumerated and multiple answers were taken into consideration. Ethical clearance was taken for the study and verbal consent was taken from the patients, and the results were interpreted using SPSS software. So out of 1512 patients who presented to our hospital and were diagnosed as glaucoma, 135 were identified as dropouts, and hence the rate was 8.87%. Out of them, 86 couldn't be contacted due to wrong or non-existing phone numbers, while 49 could be contacted, which constituted our sample size. Out of them, the proportion of males was found to be higher and those with refractory error were higher, and the common age group of these patients was found to be 61 to 65 years followed by 56 to 60. Almost 50% of the patients were primary open angle glaucoma patients followed by PSEG. And amongst all the patients who had dropped out, almost 50% were taking some kind of topical anti-glaucoma medication, followed by those who had undergone only laser PI, followed by those with laser PI plus some anti-glaucoma medication. Now this is the main chart of our study in which various reasons for leaving treatment were enumerated. The commonest cause of them leaving their treatment was lack of proper communication and motivation to the patient regarding when to come for follow-up, followed by the second commonest cause, that is their distance from the hospital, and the third cause, that is no immediate visual improvement that they experienced after starting the treatment. So as we know, glaucoma is the leading cause of irreversible blindness with around 1.2 million people in India blind from this disease. Without proper follow-up, the clinician cannot provide appropriate guidance and counseling to the patient and cannot modify their therapeutics depending on his knowledge, and so proper education to the patients are not provided. Many studies have been carried out on a similar basis, which have identified various reasons such as lack of a proper escort to come to the clinic with them and the perception that the disease was not serious enough. Age and forgetfulness were also significant factors. As lack of communication was identified as the major factor in our study, so we identified that along with routine counseling that we already give the patients, there is a need for re-counseling to these old patients who tend to be forgetful, who ignore their own illness, and also to their relatives or escorts who come along with them. We should also take the patient's education and background into consideration, explain to them with the help of pictures, and we can also tell them to repeat what they've understood so that it directs a recounseling better. As distance from the hospital was another major factor, so there should be frequent eye checkup camps in small peripheries so that these facilities are made more accessible to the general public, and glaucoma awareness with the help of radio, TV and other common mass media are required. The limitation was that while the sample size was adequate for us to find the barriers in our setting, they cannot be generalized to other populations. So I conclude by saying that understanding the patient-reported barriers to glaucoma follow-up are required so that we provide appropriate education, motivation and counseling. And as a clinician, the onus of guiding the patient properly is on us. We should explore the drug compliance as well as follow-up compliance of these patients. Thank you.